Bristow.
Thank you, Madam Deputy Speaker. And I rise as a member of the Health and Social Care Select Committee to support this bill. And as I do, like before, I want to refer members' attention to my entry in the Register of Members' Financial Interests. I rise really to argue that this money that is going to be raised by this levy is spent well, and I commend my right honourable friend, the member for South West Surrey, in his chairmanship of the Select Committee, which I serve on, and we are conducting those lessons learned inquiry to ensure that that money is spent well. And I just want to raise three areas where I feel if we focused on, we could ensure that this money is spent well and we could get the desired outcomes. The first is on capacity in the acute sector. Now, it's clear that the NHS needs to strike a long-term deal with the independent sector to try and power through the elective procedures, that backlog. We're talking about hips and knees, hernias, and those cataract operations. But I read with alarm, or hear reports from alarm, that the capacity that the NHS has brought into the independent sector is being underused. Or if it's not being underused yet, there's a fear that it may well be, because of ideological reasons, that the independent sector somehow shouldn't be used, and we should be funneling all this into the NHS. If we don't use the independent sector, Madam Deputy Speaker, then we won't have those desired outcomes. We can't let ideology dictate to ensure that people are left in pain for longer, people don't have the right quality of life, and we need to make sure that that sector is used to its full capacity to ensure that we get through this elective backlog. And similarly, we need to ensure that initiatives like Getting It Right First Time, or GIRFT, are used properly. NHS has spent money and has spent resources and experts' time really to understand what procedures work at high volume and low risk. And we should use the lessons from Getting It Right First Time, or GIRFT, to make sure that we deal with this elective backlog. Let's not reinvent the wheel. Let's make sure that we do that. And ultimately, that's usually minimally invasive techniques, minimally invasive technologies that can be done as day surgery to ensure that we power through this backlog and we can get the elective procedure waiting list under control. The second that we heard about at the Health and Social Care Select Committee is the importance of the diagnostic sector. I think in the past, Madam Deputy Speaker, we've been guilty in the NHS for focusing on the treatment of conditions rather than the prevention of conditions. And if you've got the early diagnosis correct and we invest in that diagnostics technology, then we can find out who's at risk of suffering from cancer and heart disease and other long-term conditions before they're presented at an acute level. And I think it's really important that we invest in that sort of technology in order to show that we save money in the long term. And finally, I just want to talk about innovation in our NHS in general. Because, Madam Deputy Speaker, I've worked in health politics, if you like, for 20 years. And I said this at the debate last week. And it's absolutely true, and that there is, maybe at the margins, but at least having an impact, that there is a cultural aversion to the private sector and to technology and to innovation in our NHS. And that just needs to be dealt with straight away. Because if we don't adopt innovation, we don't adopt new technologies, new pathways, new ways of doing things, then we're not going to ensure that this money is spent well. And I would challenge, perhaps, that one thing that may come out of some of the reforms that we're looking to bring into our health service is that we appoint an innovation officer or someone responsible for innovation in every NHS trust. Make it their job. Because I welcome, Madam Deputy Speaker, that we are at last beginning to ensure that the NHS will have a degree of accountability again. And politicians will have the ability to challenge NHS managers, trust managers, to make sure that this money is spent well. And one way we can do that, Madam Deputy Speaker, is ensuring that we have an innovation officer, someone responsible, that reform, innovation, new pathways are adopted, and we make sure that this money is spent well. Because if we don't, Madam Deputy Speaker, we could be here again. We could be here again in 3 or 4 years' time, and that money that we want to transfer to social care in due course is gobbled up by the NHS, as my right honourable friend, the member for South West Surrey, said was a real risk. So that's, as far as I'm concerned, 3 real challenges on acute capacity, on ensure we invest in the diagnostic capability and we make sure that innovation is properly recognised in our NHS.